Welcome, everyone, to the La+Jolla+Cosmetic podcast. I'm your hostess, Monique Ramsey. And I, as a person in her 50s, I'm super excited about this topic because we're going to talk to Dr. John Smoot, and we're going to talk about what kinds of procedures when you're in your 50s seem to be indicated for some of us. A lot of these aging things start in our 40s maybe, but you start to really realize them in your 50s, and whether it's your eyes or it's something around your jowls and your neck, or if it's on your body. We're going to talk about all that today. So welcome, Dr. Smoot.
Thank you. Glad to be here today.
So let's talk about things that, women and men in their 50s might be considering. And I think we'll start with women and we'll start with breasts. And I think breasts, depending on even if you haven't had kids, but certainly if you've had kids or if you'd had a previous augmentation. So we'll get into sort of like what are the things that women might do with their breasts. And I think the first one is maybe a breast lift. And do you see that as something that women in their 50s are kind of looking at?
Well, we need to start back kind of a bit of an overview before we focus on those certain age areas. Understand the aging process. As we get older, several things happen to our body. One of which is we either can gain weight or we can lose weight. But more importantly is that what happens to our skin as we age, we lose elasticity. And that's usually what causes the problems as we move into that 40 and 50s and 60s, is we see that laxity occurring. And it can happen in the face, it can happen in the breast, the abdomen, thighs, all that can happen. And it's when they finally look at themselves in the mirror and go, oh my, this doesn't look like it used to. And losing weight sometimes just loses the weight, but it doesn't allow the skin to correct itself. So understanding that different periods of your life, different procedure will work differently and look different. But you're right. Most of the changes most women start seeing is when they're 40s and 50s, when they said, I don't look like I did when I was 20 and 30, now even 40. So having said that, some of the things that we're going to recommend or talk about today is what are some things to counteract those effects of aging and gravity. Now, you talked about asking me about breast augmentations. Well, some will think, well, why would we want to have a breast augmentation at 50? Well, some do. They've gone all their life not having some shape or form, not fitting well in their clothes, having to wear padded bras, etc. So it is doable. And I do have patients that do come in and want to have augmentations. Usually it's much more conservative at that point in their lives, which is fine. But it's not something we can't do. I've done someone in their 60s. Finally said, yeah, I want to have this. And so that's one of the reasons we look at is what is their motivation to have this surgery. Mostly at that point, it's just, I just want to look better in my clothes. I want to have a little more confidence. So that's kind of how we look at breast augmentations when you're in that fifth decade.
And what about the women who maybe had their augmentations in their 20s or 30s, and now they're in their 50s? Is it typically that they're maybe now at this point needing a lift or in a revision, or what are you seeing in that?
Well, it's a spectrum of things we see. Typically what happens is as a woman ages, two things happen. One is they tend to gain weight and the breast can get bigger. So the implants they had put in their 20s or 30s now are, whoa, I just not comfortable anymore. I'm just too big. Or they haven't gotten bigger, but because of that elasticity effect, we get what we call a waterfall effect, where the tissues droop off the implant or the whole breast sags. Those are the determining factors of what we need to do. Someone say, well, I have to have my implant changed every 10 years. No, you don't. I always tell my patients, if it ain't broke, don't fix it. So if there's no need to change anything or do anything, don't do it. Now, these implants sometimes only last 10 years. Most times they'll last 30, 40 years. But that's everyone's individual needs and requirements dictate what we'll do. It depends on what their goals are. Is it because they're too big, they don't want them anymore, or no, they're not big enough, they want to look perkier? Yes, all those factors come in. But when I look at someone basically coming in their 50s, is the first question I ask them is, do you still want implants? Yes, I do. Okay. Do you want to be bigger, smaller? It could be either one. Then I look at what is the shape that they want. A lot of times they'll show me pictures, and sometimes it's realistic, sometimes it isn't. But what I want to know is, do they want that more youthful look? And what happens is the nipple starts to drift downward. And the big determining factor for me is when I look at the breast, I put my finger in the fold of the breast. And if the nipple falls below that fold, they need a lift. You can do all the augmenting and implant changes or whatever you want, but it's still going to droop. So that's what I look at, if they need a lift or not. But again, some women don't want a lift, which is fine. But I want to explain to them the outcomes of each decision.
Yeah, I think sometimes we tend to shy away from things that seem like, oh my gosh, that's so many scars. But I think one of the great things about having a consultation is that you're explaining the trade-offs. What would the trade-off be if you don't have a lift? And you get to see a lot of before and after pictures of mature scars. And there's so much scar management that happens after surgery that's, trying to make the best perfect scar that you can. And everybody's body makes a different kind of scar. But, those are things that it can be managed, and then they sort of disappear after time. And that scar issue, it kind of becomes a non-event. So I think you're right in terms of what's that goal that you're looking to achieve.
Yeah, because there is a trade-off for, if they need a lift or not. The trade-off is a scar. But that trade-off for having a more shapely, better looking breast that fits better in the clothing, it might be worth that trade-off. And there's some might say, that's not worth the trade-off for you. Or, yeah, you'll really benefit from this. But the other problem comes up is, we talked about this in a previous podcast, is what if the implants are hard? Okay. That's probably one of the concerns I see. And I deal a lot of that because I've had these implants for 20 years. Now they're hard. My breasts droop. And there are things we need to do, but it's a little more aggressive. And that's what we talked in a previous podcast about, using called ADMs or grafts to keep the pocket soft so you don't look hard and feel like baseballs anymore.
Right.
That's one of the things we like to manage too, but we talked about that at another podcast.
And we can put that in the show notes too. Let's say they are having a lift with augmentation, and is it like a week recovery? Kind of how long? And is recovery different in your 50s than it might be in your 30s?
Yes and yes. Okay. When we do augmentations later in life, it's a little easier to do the surgery. Our tolerance to pain as we get older is better. Younger patients tend to really feel the pain more intensely. I think it's because of just being youthful and the fact that tissues are tighter and firmer. But being able to heal, regardless of your age, is still about 2 weeks before I say, okay, you can do pretty much regular activities at this point. The area that causes the pain is whether I have to go into the muscle or not. And I tend to put most of my implants under the muscle, the pectoralis muscle. I think that gives it a better shape. It holds its shape better and longer and reduces one of the concerns of hardening, or called capsular contracture. So as we get older also, we scar better too. That's the thing that's interesting, that I see that older patients tend to have fainter, wider scars than younger patients. Not always, but that's why it's a little easier to operate on someone later in life.
The more you know. Now, if a woman's getting a breast lift and maybe with an augmentation in her 50s, are those, like, how long will those results last?
Okay, well, a lot of it depends on what their genetics are. What do they have to work with? How big are their implants? What is their desired outcome? Now, none of this we've talked about will last forever. And as you know, the young girl comes in, wants augmentation, was sitting with the mother. I turn and I say, things change, don't they? And they go, oh, yeah, they do. But I don't know, with pregnancy, with weight gain, with all those factors can affect the longevity of it, how they look. But one thing I can guarantee is they'll change.
Yeah. Well, isn't that a constant
Yep.
in life? Okay. Another area where some of us might be finding that we are aging is around the eyes. And eyelid surgery, I think, is, a wonderful sort of quick fix, if it were, as it were, to youthen your whole face. So what happens to the eyes to men and women in their 50s?
Well, what typically happens is we get laxity of the upper lid skin, and meaning that skin starts to drift down. We get excess. It starts hanging over the eyelashes. The brow can also start to descend and relax, giving a heavier look. You don't see that as often. But yes, that's one of the things that occurs. The other problem is bags under the eyes. It makes you look tired. This is an operation that it's quite easy to, I don't say easy to do, but it doesn't take a long time to do. But it's one of those procedures that really changes how the face looks, and in terms of making it look more youthful, awake. Gee, I can see your eyes. And they say, well, how do I need a lift or not? Well, part of the time is, do you have to lift your skin up when you have to put your makeup on? Mm. And that's one of the tests I say, okay, if you're having to do that, yeah, you probably could benefit from eye lift. Now, a lift is really not the right name for it, but that's what we call it. Basically, it's an excision of excess skin above the eye. And it's put in a position so the scar sits right in the sulcus, or the curvature of the eye, the crease in there, and we can hide it along the laugh lines as well. So it's a really good procedure to have someone just kind of get their look back, to see their eyes again, to say they look rested. So it's one of the operations I do enjoy, because it's quite dramatic when it happens.
And how long is the recovery if somebody were just to have their eyes done, upper or lower?
Well, okay, recovery and being in the public are two different things.
True.
Okay. It takes about a week before the stitches come out, and you're pretty much functional and doing everything at time, but you still may be bruised, swollen. Usually by 10 to 14 days, you can be out in the public eye again. With women, your little makeup, fine to do it. But most of the bruising, swelling is all gone by then. You do have a little bit of tightness and some irritation that could last for a few weeks, but essentially you're ready to go by about 10, 14 days.
Okay. Now, what are the typical procedures that people might combine with an eyelid lift?
Well, mostly when I'm doing eyelids, now you got to look at both upper and lower lids. It's not, some people are bothered by both, some are not. But usually I do it in conjunction with the facial procedures, the mini lifts, the full facelifts, the neck lifts. Those are usually what I use it in conjunction with. You could do them independently, but it's kind of like, well, if I'm going to work this canvas, let's work the whole canvas, not part of it.
And is waiting until you're in your 50s too long to wait for your eyelid lift, or is that very dependent on the person?
It's dependent on the person. It kind of, what I tell patients, I said, this is what you have. This is the result we can get. Now, if that's worth the cost, the risk, the recovery for that kind of improvement, okay, let's do it. Now, one of the thoughts is, well, if I do a little bit more often, it'll last longer. Yes, and I kind of espouse that. The more you upkeep it, the less you have to do as you go along. The other one says, well, no, I'm going to do this once and do it when I really need it. But then it's a little harder to get a better result, and it's more dramatic when it gets done. So I can't fault either one, but mostly it's just when it's worth the cost, the hassle, the risk for the benefit you want to achieve.
Now, getting into, you mentioned the facelifting, and you mentioned short scar facelift. What is a short scar facelift?
Okay. It's a nomenclature that I use. It's a little more common among plastic surgeons. It's a procedure that was described Dr. Turnad several years ago. It's basically a way of just lifting the jowls and not really addressing the neck. It does help the neck, but that's not its primary focus. It's just to make it, what I more call it, is a refresher. You just look a little better. The jowls are a little higher. It's not something you'll look at someone and go, oh, you had a facelift. Yeah, it doesn't do that. It's basically to refresh and make you a little brighter. It doesn't mean you can't have the full face and neck lift later, but it just may push it down the road farther. So it's a good alternative for people who just need a little bit of refreshing, but not the major retightening.
Is that sort of like where we all tend to put our hands close to our jaw and our ears and we pull? Is it there? Is that where you're aiming for?
The hound dog, the jowls, it's just lifting that up like that. That's what we do. Now, it does help the neck a little bit, but I tell patients it's not meant to do the neck. Now, if there's a lot of excess laxity and fat in the neck, this is not the right procedure. It's someone who's a little younger, has very good skin, and we can tighten it without having to do a lot of aggressive surgery.
And is there a lot of scarring with that? Or it says it's a short scar.
Yeah, well, it is.
What does that mean?
Okay, that's a good question. The short scar means that it just it goes from the hairline down in front of the ear to the bottom of the ear. Now, in a traditional lift, you use that same scar, but it now goes behind the ear and back into the scalp. That going back behind the ear allows me to get into the neck and do neck procedures. A lot of times people say, well, can I just have my neck done? Well, you can't really separate the neck and the jowl separately. It's kind of one canvas, like I mentioned. You've got to make the canvas blend together. So it's very often you have to go in front of the ear to adjust for that excess skin, and you make it smooth it out so it looks smooth and looks like it's all one contiguous canvas, so to speak.
And then, so at a consultation, somebody might say, okay, I think I want a short scar facelift. And you would look at them and see if that's appropriate, or is it maybe better to move to the next step? And what's the next step? Is that a full facelift or?
Yeah. Well, again, it's what they want. I mean, again, I'm looking at what they're willing to go through for what they want to achieve. Now, some people come in and say, I don't want much done. I just want a little mini lift done. Well, it doesn't work for you. It's not the right procedure. And so you have to, I don't want to use the term upsell, but you need to explain to them why the full lift is a much better choice than the other. Sometimes it's, okay, I could do either, but here's the limitations of this. So I like, mostly what I was just educating the patient so they understand the decisions I'm recommending, the decisions we're making are in their benefit. But I'm not doing it just to make more money.
Right, right. Well, I think that's evidenced by your reviews. Patients, we have patients giving feedback every day from the time after they have a consultation with you and after surgery with you. And I think if you were trying to push stuff on people that they didn't need, you'd have a lot of angry patients, and that's not the case. So is there any difference for men? Because I think men are just talking about the eyes, talking about the lower face. What are some of the things men can do specifically, and what maybe are the challenges?
Okay, well, men can do all the same things except for the breast augmentations, obviously, but
Good point.
but the face and the eyes, yeah, that's essentially the same approach. It's a little more difficult with men in the sense that men don't wear makeup and we have beards. So we have to place the scar a little differently. You have to anticipate that placement so it's not as visible. The other problem with men doing facelift is you pull the beard up behind the ear now. So shaving has to go behind the ear, which they don't do before. But, that's a trade-off. And getting all that turkey gobbler out and getting that neck tight and kind of cut out again, that chiseled look, we have to do that.
I have a wild idea. Could they, okay, if you're a man, you're having a full facelift, face and neck, could they have laser hair removal back in the area that the hair grows behind the ear now?
Oh, well, you don't want that. You want the
No?
hair to grow through the scar.
Oh, okay.
That's what we're trying to do. That's why the way I place the scars is to minimize the visibility of the scar by placing a long hair in the hairline so you don't see it.
Got it.
That's why I like that. But the other thing that I failed to mention is why men are a little more difficult is because we have beards, we're much more vascular, and the risk of bleeding is much higher in men. So we have to take a lot more time and effort to make sure that the bleeding and there is all being taken care of.
More vascular. So there's more little vessels in the skin
Yes.
of a man?
Right.
Oh,
so the propensity for bleeding is higher.
Ah, okay. Now, getting into talking about bleeding, because that made me think about a lot of us in our 50s might be on blood thinners, or we might be on statins, or we might be on all these different wonderful medications for aging. What kinds of suggestions do you have for patients prior to going into surgery?
Well, we want them to be as healthy as they possibly can be. Now, some of the things like blood thinners, that's a definitely contraindication doing surgery because you don't want them to bleed to death. So they need to be off those. Most of their medications they continue taking. And most of the ones I see are blood pressure medications, which they do need to take to control that. Sometimes they take some cancer drugs, antimetabolites, but again, we want them to get off it because that's going to affect healing. But, the diabetes, as long as they're well controlled, their blood pressure is well controlled, these are not real hindrance to doing surgery.
And would you say, I mean, if you were going to guess on the average age of your facial rejuvenation patients, where is that? Where do people finally kind of go, okay, it's time?
Well, for me, it's the 50 and 60s. That's usually when I see it. You see a few getting those mini lifts in their late 30s, early 40s, but the majority of them, their kids are gone. They are out and about more. They just want to look better. And that's the point I want to make when I do these procedures. I'm not trying to make them look different. I'm trying to make them look better. And that's my goal. So I'm not going to pull them tight so we look like a lounge lizard from Palm Springs. Okay. So you get my drift on that. So,
Yeah.
okay.
Yeah. I think that's what most of us want. We want to look natural. We just want to look, like we might have in our 30s, and just that youthful restoration.
Yes.
And, I think there's so many wonderful things with, non-invasives, but at some point, the non-invasive things just start to not work as well. And you have to jump ship over into the OR.
Well, that's right. And that's usually where you see that transition in the 30s into their 40s. I just can't, fillers just not doing it anymore. I've maybe had some lasers, I've had some thread lifts, and they're minimal procedures, but they have minimal results too. But maybe during that time frame, that's all you need or want.
Now, getting into body contouring, could women still have a mommy makeover in their 50s?
Yes, very much so.
And I saw something on an article I was reading, and they were, somebody was talking about, well, I had lipo, but now my skin is saggy. So, how do you talk to people who are thinking about some body contouring and what that should look like? Or when is the best time to do that? And when is it not?
Well, the best time to do that, obviously, lipo is when you're younger. That ability for the skin to contract is much better. It's much better to get a result. As I mentioned earlier, the older we get, the elasticity tends to diminish. And that's where you get the irregularities, the droopy skin. And some patients will look at them and say, look, I can remove the volume, but your skin is going to look exactly the same. If you have cellulite, you have dimpling, you have laxity, it most likely will not tighten your skin. And you may need to do that transition to that surgical procedure of having skin removed. And that could be from a mini tuck, full tuck, circumferential tuck, with liposuction. We're more into the contouring issue, where we're just not moving skin. We're looking at the upper abdomen, the flanks, the back. So we enhance the silhouette, we enhance the figure. So it's very common now, not only to do a tummy tuck, but to include liposuction around the back and flanks area and sometimes in the legs to sculpt the body. That's why I think some of my partners are doing this 360 lipo. You have to look at the whole body contour.
Yeah. And speaking of the lipo, so you're taking fat out. When getting back into that facial surgery, do you do any fat transfers to the face? Is that something that can help, and how can it help?
Yes, that's almost part and parcel of doing facelift surgery at this point. When I first started, that was unheard of. Very rarely did we do fat transfers. But now, with the technology and the know-how, it's very common to add fat in certain compartments of the face, depending on what you're trying to achieve. So, yeah, it's not a hard thing to do. The nice thing about fat that it's natural. If it lasts forever. The unfortunate problem is sometimes it doesn't last, and it's not always predictable. But if you put fillers in, I can guarantee it'll go away.
Mm-hmm.
Now, fat can also enhance it. It's the fat that gives the volumization to the face. That's what gives you your youthful look, healthier look. So that's why we like to use it.
Now, when somebody comes in to have a consultation with you, can you describe a little bit of, what does that entail in terms of the questioning, and then maybe what are the things that you can show them to demonstrate, how they might look after surgery?
First of all, I need to know what their desires are. What is their expectation? What are they trying to achieve? Now, with the breast augmentations, we have a computer simulation, which I can kind of show them. Same with lifts. This is what will look on it's not exactly the same how they'll look on their body. The facial is not, it's easy to show them that with those kind of technologies. All we can show them is with prior patients, the different procedures and techniques we use so they can understand what we've used.
And then after they have their consultation with you, they're going to learn about the prices. And sometimes, there's maybe different ways to go at the problem or the concern for that patient. So, what I've seen is that sometimes people will have more than one quote, like here's if we just did the eyes, or here's if we added in a short facelift, and what those quotes look like. And I think, if you were going to have things separately, it's going to cost a little bit more because that first hour of the operating room in anesthesia is the most expensive hour. So
That's
it's
correct.
sometimes combining. And then if you're going to have the downtime, sometimes doing it all at one time and getting it over with might be the way to go.
Yeah. Well, agreed. One anesthesia, one surgery, one recovery makes a lot of sense. But we have to also consider the time factor, the age factor, your health. What can we do safely? We don't like to do phases pretty much over 6 hours. 8 hours is the absolute max we will go. So we have to limit what we can do. Now, I've done enough in my career that I know how to do most of these procedures under 6 hours. But still, we have to be careful about trying to do too much. Mm-hmm. But for the patient, it makes a much better outcome financially and time-wise to have it all done at one time.
And just for people listening in the audience, we have all of our price ranges on our website, so you can kind of get an idea of some of these different procedures and the range. And sometimes the range is kind of big because that procedure could be done any which way from Sunday. And so once you have that consultation, and it's free, there's no charge, and you meet with the doctor and see the before and afters, get the lowdown of how to achieve your goals, and then have that quote. And then the patient coordinators are really great about helping figure out getting the right date on the schedule. If you want to have help with financing, we work with a bunch of companies, and that's very typical that people will finance part of it, and that's kind of a nice way to get what you want now and pay as you go. And
full package.
Yeah. And now I know we were doing virtual consultations because of COVID 4 years ago, but I think a lot of people still like that. And especially if they're from out of town, do you still offer the virtual consultations?
I do, but it's not the same. You get some general idea of what they're after, but particularly with facial surgery, eyelid surgery, it's really hard to look at them and say, yeah, or show them what needs to be done. So I give them an overview, but I said, I really need to see you in person. And the same with the breast surgeries. It's just not the same, feeling the tissues, seeing how lax they are, how tight they are, what blemishes they have. You can't see in a Zoom, but it's helpful to get us as a starting place.
Okay. Well, Dr. Smoot, we covered a lot for our Gen X people and our younger boomers for the people in their 50s. Did we miss any procedures that you find that is good for this age group?
No, that's pretty much the bulk of what I see. Like I say, my practice is aging. So I see a lot of my older patients that I treated, 20, 30 years ago are coming back in now and need adjustments or, improvements, which is fine. But the nice thing I have is experience.
You do.
and I knowledge is nice, but experience is always trumps knowledge.
That is true. That is true. And so if you're listening today, you have questions about scheduling a consultation or financing, we'll have all the links in the show notes. We'll have links to photos, reviews, prior podcasts with Dr. Smoot, and you'll see some of his beautiful photos. So we'll have links to all that in the show notes. And thank you, Dr. Smoot, for sharing your time with us.
Well, thank you, Monique. It's a pleasure to be here. And I hope I've done some good educating the audience here.
Yeah.
And I'm happy if any of them would like to see us or come see more, I'd happy to see them.
Wonderful. Well, thank you. And thanks all of you for listening. And be sure to like and subscribe and leave us a comment. If you go watch us on YouTube, you can leave us a comment there and we'll answer if you have any questions. So thanks, everybody, and we'll see you next time.
Thank you.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.